what would you like those folks watching who may be interested but don't know a lot about clinical trials?
Trials aren't right for everyone, and a specific trial might not be a good match for an individual patient. So I view this a little bit like matchmaking. Before I really answer your question, I'll comment that the placebo I mentioned before was standard therapy versus plus placebo versus standard therapy plus new drugs. Nobody was getting less than the standard in that trial. And we have strict ethical standards here. So there are multiple levels of vetting of clinical trials, right? So the first is there adequate scientific promise, right? When you combine the science with a little common sense, is there good reason to be excited that this can actually help people? That's vetted at many levels before a site will consider a trial. So someone proposes an idea. There's many levels of scientific vetting. It's vetted at the FDA to get something called IND, which is the FDA's permission to do a trial that they think it's sufficiently promising, ethical, and appropriate. Of course, you have to convince a funding source, be it a grant or a company, to give money to do this, right? These are fantastically expensive. So before a site even considers it, there have been a lot of vettings. But then, it might be helpful to walk through what happens from there to it being recommended to an individual person. So, all across the country in research groups like ours at UNC, when we have a trials offered to us, we'll sit down and we'll go through the science of each of the trials and we'll say, is this promising? What is the most promising thing that, in our opinion, and we can be right, we can be wrong, but using our scientific knowledge that we think is most likely to really be a home run for patients? And then we say, okay, what is known about side effects? Either because people have been treated or because we can use the mechanism to try to predict how likely it is to have side effects. And then we look at how patient friendly the trial is beyond efficacy and side effects. And then once the research group says, okay, this is the trial that we think is most scientifically promising to actually help people, acceptable for toxicity relative to efficacy, patient friendly in terms of the demands on the patients, or the patient friendliest of what's available to us. And we say, okay, we want to proceed with this. We think this is a good trial for our patients. Then it goes to a level of scientific vetting. At my institution, it's called a PRC committee that vets the scientific promise. If PRC gives their okay to it, then it goes to IRB, which vets the ethics and human subjects protection. Um, and then if IRB accepts it, then and only then can you start up and actually consider it for an individual patient. Then comes the level of vetting, not of, is this a good trial? That's been accomplished, right? If you're an ethical place, you've already opened the trials you think are best in general. But then you have a human being in front of you, and you need to look at the biology of that person's cancer, their physical status, their strengths, their weaknesses, and most importantly, their values, and say, is this the trial I'm going to recommend for this individual person, right? If it's a trial that requires a lot of travel or long times in the chair, someone who can't afford the tank of gas to come in, that may not be the best fit for them. Something that is really cutting edge, totally new, first in man, may be exciting for one person who's a scientist and is exciting about what's cutting edge. For someone who's a little more skittish and wants things a little more established, maybe that's not the right fit for that person. And so there's a vetting process then that very much involves patient and family, of a conversation of not just, is this a good trial, but is this a good fit for the situation you find yourself in? And is this a fit for what you want, for your values? And so it's this many, many, many tiered vetting process of not only is this good, but is this good for you?